Well, good afternoon. Thank you for attending the Raising the Bar Compliance webinar. My name is Jason Cleary. I'm one of the employer group health insurance specialists here. As you can see from the screen, we work with multiple different associations on insurance solutions, including our private exchange that we've had since 2014. You can see we work with the Missouri Bar, Florida Bar, Texas Bar, FICPA, and Florida Medical Association, just to name a few. Excited about this webinar. Obviously, if you've been following our communications, you see that we've also been conducting similar webinars for group products and group solutions. We had one previously on our private exchange for a group option, and then just recently last month we did a webinar on alternate funding as a solution. So you can go to memberbenefits.com and click on your association, and those webinars are both available and they have been recorded for you. And this webinar will also be recorded and be out on your association page. I do want to mention too that we will be answering some questions at the end of the webinar. So on your toolbar, just go ahead and type in your questions, and then we'll leave plenty of time to answer those at the end. So this webinar is mainly focused on compliance issues, as we mentioned, raising the bar on compliance and protecting your firm from Department of Labor and IRS penalties, which is obviously a big point of discussion, and a lot more has happened since the Affordable Care Act. And I'm just going to introduce our speakers and then hand it over to them. The first one, Derek Ashton, he's the Director of Health and Welfare Compliance, and then Sarah Bernhardt is the Legal Compliance Specialist. And then we also have Michelle with us here too. She's the Chief Legal Counsel and Director of the Affordable Care Act Unit, and she's going to actually be doing a webinar next month, particularly on the ACA compliance and the 1095 reporting. So we'll put that out and look for that. But without any further ado, I'm going to just go ahead and turn it over to Derek and Sarah for the presentation.
All right, thank you, Jason. It is really great to be with everyone today. We appreciate you joining us for this important webinar, and we do have some very important information to share today. Our goal is to be very informative. Obviously, there will be some issues that we won't be able to dive down into, but we want to be very informative and provide a broad overview of compliance requirements and solutions related to your health and welfare benefit plan documentation. And as Jason mentioned, in the era of the ACA, the potential for employers being penalized by the Department of Labor or the IRS is greater than ever as it relates to health and welfare benefits. And that's really the reason for today's webinar, is we want to make sure that you have the information available and the solutions available to protect yourself from potential penalties that would result from a DOL or IRS audit of your health and welfare benefits. And so our agenda today is just really very simple, to cover three areas. The first is, why is compliance in this area of health and welfare benefits important for you as an employer? After we look at that, we're going to look at some essential plan documentation, and specifically we will be honing in on the areas of cafeteria plans and wrap documents. And then our third part of our presentation will be offering a solution that we call Operation Comply. And as a part of member benefits, you have access to a great opportunity and some special pricing on some solutions in this area. So we want to make sure and make that known to you, and that will be the shortest part of our presentation, but we don't want to leave you without any potential solutions as we look at this material. So the question is, why is health and welfare compliance in the area of plan documents more important than ever? And to further explore that question, I'm going to allow Sarah Barnhart. She is a licensed member of the Florida Bar and one of our compliance specialists. I'm going to allow her to talk about some of the potential penalties that can be issued by the governmental agencies in the event of an audit.
Thank you, Derek. As Derek touched on before, compliance is more important than ever now. The danger is real. We don't want to scare you. We want you to be informed, though. If you look at, just highlight a couple of these potential penalties. For plan documents, for example, you can face a $100 a day penalty per affected participant. For late distribution of your summary plan description, or SPD, face penalties of $110 per day. Also, looking at the Form 5500 reporting, face penalties of up to $1,100 a day for late or incomplete filing. No idea where they came up with that penalty, but that can quickly add up. So it's important to note, if you do have any health and welfare benefits, you do have exposure to any of these penalties. All right. And this is the time that you are more likely than ever to get caught. The Department of Labor and the Internal Revenue Service, or IRS, are responsible for enforcement of these health and welfare plans, and the level of audit activity has increased since 2010, with an increase of over 10,000 new auditors as a result of the ACA. And they're now auditing groups with fewer than 100 employees. This used to not be the trend, but there now have even been groups as small as 2 employees that are being audited. And 75% of audits result in the discovery of some ERISA violation, and then 70% of those result in monetary penalties, which comes down to the bottom line of 50% of DOL or IRS audits will result in paying penalties, which is why part of our purpose today is to make sure that you're not one of those employees or employers who has to pay penalties to help cover the cost of health care reform. So what triggers an audit? They're really unpredictable. There are a number of things that can cause an employer to be audited. One is the IRS tax. It could be incorporated with an IRS tax audit, 401k, etc. Especially now that the ACA forms and all of your information out there, they have all the information so they know how many employees are enrolled and who is over 100, who needs to file 5500 filings. Also, it could be a disgruntled former employee, especially HR employees who have all the ins and outs of the business. Could also be flagrant violations. Bottom line here is, if the employer is on the front page of a newspaper, the Department of Labor is probably going to come knocking on your door. And also, they can just target by a certain geography or industry.
All right, so we've started to answer this question, but we'll go ahead and drill down a little further. Why should we be concerned specifically about plan documents as it relates to health and welfare plans? The first reason is the documentation you have as an employer today may not meet all of the requirements of ERISA specifically. And it's very common that the insurance carrier documents that would be provided, the certificates of coverage provided by an insurance carrier for ERISA benefits, in almost all cases today do not meet all of the ERISA requirements. And so there are some gaps that exist in existing documents. And if you don't supplement that in some way, it's possible and highly likely that in the event of an audit, there could be some difficulties. And we'll dive a little deeper into where some of those missing items might be as we go through the rest of the presentation. The other point that's really important related to plan documents is there is a distribution requirement for an ERISA SPD. It's got to be within 90 days of enrollment, within 120 days of establishing a new plan, and if an employee were to go to their manager or to HR and ask for the summary plan description, you have 30 days to provide that to the employee. If you don't have a complete summary plan description, if all you have is those insurance certificates, or if you don't have anything to provide to them, you could find yourself in some real trouble in the event of an audit. And then, of course, a really important point to make is that all participants who are affected by a violation can potentially trigger a penalty. So with plan document and SPD penalties of $100 or $110 per day, if you have 50 employees who are affected by that, you're looking at a $5,000 per day penalty at the $100 per day threshold. So this can very quickly add up. As Sarah mentioned, on some of these penalties, they add up very quickly, and some of them are much worse than they look on the surface. So again, our purpose today is to make sure you're not paying those penalties, but can be compliant enough that a DOL auditor is not going to find you guilty. So what is some essential plan documentation? The two areas, again, that we want to look at today would be your cafeteria plan and your wrap document. And so we'll look first at what is a cafeteria plan. For those of you in our audience today who are CPAs or attorneys, you will probably recognize this section of the tax code in the Internal Revenue Code, section 125, paragraph D. Going right to the text here, we find the definition of a cafeteria plan. It's very simply a written plan that allows employees to choose between either receiving a taxable benefit that would be considered cash, or a qualified benefit that would be a non-taxable benefit. And the most simple kind of cafeteria plan, the most basic type, is what we call a premium-only plan. If you're not familiar with the terminology, they're sometimes called premium conversion plans, and we call them for shorthand POP. So it's a POP document, or a POP plan is the most basic cafeteria plan, and almost all employers have these. And what the POP plan allows you to do is to take advantage of those tax code allowances that would allow for an employer to give the employee the option to purchase benefits on a pre-tax basis. So very simply, if Sally has a salary of $20,000 and you have a POP plan and she purchases her health benefits at a cost of $2,000 per year through the POP plan, then what happens is the $2,000 is taken out before the taxes are applied to her income. And so in effect, she would be taxed on an amount of $18,000. That's what might appear in the box 1 of her W-2 if she ran $2,000 through the employer's POP plan. So the nice thing is she has a lower tax burden, and you as an employer also have a lower tax burden if you have one of these types of plans. One of the catches to this, of course, we like to say the IRS giveth and the IRS taketh away. They do offer this tax benefit, but they also require an irrevocable annual election to be made. So Sally has to choose. She will be in that health plan, and she could be required to stay in that for the entire year under a POP plan unless specific qualifying events occur to allow her to make a change. And of course, there are non-discrimination requirements as well, very important to keep in mind. And Sarah's going to discuss now some of the essential plan documentation related to these plans.
As Derek mentioned, you know you need a written document for a premium-only plan, but it is important to know what documents you actually do need. First, you need the actual plan document. You also need some kind of descriptive materials. An SPD is customary but not technically required. You should also, or you should be aware and treat the premium-only plan document as a legal document. So if any plan provisions change, you should formally amend the document. And also, you should need a salary redirection agreement. It's customary to have this, but this can be verbal, electronic, it can be written. We, however, do think it'd be prudent to have some sort of written documentation of any agreement. All right, and we have talked now about premium-only plans. Our next important plan to discuss is our ERISA wrap plans. Just having a premium-only plan is not enough. It's important to note that the WRAP and the POP are separate and different. They have different purposes and separate from one another. The WRAP plan deals with ERISA compliance. The POP plan deals with the tax code in Section 125. The WRAP plan is the basis for the single ERISA plan, and the POP plan is the basis for pre-tax premiums. WRAP plan includes ERISA health and welfare plans, and your POP plan includes benefits offered on a pre-tax basis. And it's important to note that the benefits offered through the POP plan and in the WRAP plan may be different from one another, which is why it's important to have a WRAP plan and a POP plan in place. And for the WRAP plan, compliance is required by the Department of Labor. For the POP plan, compliance is required by the Department of Labor and the IRS. And a WRAP plan is necessary to have in place to avoid ERISA penalties. The POP plan is necessary to have in place to avoid potential loss of tax advantages.
All right, thank you, Sarah. And as Sarah has mentioned on that last slide, a POP or cafeteria plan is a very different thing than a WRAP plan. And you want to keep those two very distinct in your mind as to their purposes and as to what they cover and which benefits would be included under them. So just to summarize once again, the POP or cafeteria plan is all about tax code compliance, and the WRAP plan is all about ERISA compliance. That brings up a big question. What exactly is ERISA? And for those in our audience who may not be familiar with this law, it's been around since 1974. And I always like to say that I was born the same year as ERISA, hopefully not giving away too much information there. And just as I have changed and grown over the years since 1974, ERISA has as well. A lot of requirements and amendments have been made to this law, and it has increasingly required more and more of employers as a result. ERISA was originally intended to protect participants, that is employees and their dependents, from abuse and mismanagement of funds. And although in the name it says Retirement Income Security Act, ERISA actually has two sides. One part of ERISA deals specifically with retirement or pension plans, 401ks, 403bs, items of that nature. And it also deals with welfare plans. And our topic today excludes retirement plans and deals specifically with welfare plans. In the past, it has not been surprising to find retirement plans subject to audit. It's not been surprising to anyone that they're subject to non-discrimination testing and a plan document, SPD requirement. All of these things that we're talking about have really been commonly enforced and heavily regulated on the retirement plan side. And on the welfare side, where we're talking about health benefits, dental, vision, life, disability plans, items of this nature, there has been much less enforcement prior to the advent of the ACA. So again, part of the reason for today's discussion is this area has come much more sharply into focus since 2010 and the ACA and the hiring of those 10,000 new auditors who are out looking for ways to help support the financial side of the ACA besides needing to cover certainly supporting their own paycheck. As we look at a WRAP plan, it does specifically deal with the welfare side and covering deficiencies that might be found in your documentation. So before we look further at documentation specifically, let's talk about ERISA in general. It does have strict fiduciary responsibilities for plan sponsors and plan administrators. In most cases, the plan sponsor, according to ERISA, is the employer, and the plan administrator in most cases for these benefits is either the employer in general or a specific person on the employer's staff, if they're named. So this does bring those fiduciary responsibilities directly to your doorstep, and it requires that you take prudent action and care in the way that you administer these benefits. It also requires, under ERISA, a written plan document, similar to the IRS requirement that a cafeteria plan be written. In the ERISA statutes, it requires a plan document, and then it goes beyond that and also requires specifically that the employer have a summary plan description to provide to employees for each health and welfare benefit plan. And it also mandates reporting and disclosure by plan sponsors with annual Form 5500 filing requirements. And those filing requirements for retirement plans typically apply to every plan. For the welfare plans, there is a general exemption for most plans that if you have less than 100 employees enrolled on the beginning of the plan year, you are generally going to be exempt in most cases from the 5500 filing requirement. What that means is large employers need to pay very close attention to this area of ERISA in the 5500 filings. Now, the next question we have, now that we've talked about what ERISA is, what plans and what types of employers are subject to ERISA? A great misconception that is out there today is that ERISA doesn't apply to employers who are in a nonprofit status, and that is not the case. The types of employers that are exempt from ERISA would specifically be governmental and church employer types, and their governmental plans and church plans would not be subject to ERISA in general. And so the way to remember that is we used to say when I was a child that you should never talk about religion or politics in public. And when we talk about ERISA, we have no choice because those are the two exempt areas, so we're going to have to talk about and mention both religion and politics. So that's a handy way to remember if you're familiar with that, that phrase. It's a good way to remember which plans are generally not subject to ERISA. What this means is if you're not a governmental employer and you're not a church employer, then you are very likely subject to all the requirements of ERISA. And this would apply to plans specifically such as your health, dental, vision, life insurance, HRAs, FSAs, disability plans generally are subject. Wellness programs and employee assistance programs would be subject to ERISA if they're providing a significant medical benefit of some kind. The way the Department of Labor defines medical benefit may be different than you think as an employer, so you really want to watch this area. Many advise that even if you're offering something as simple as flu shots or biometric screenings as part of a wellness plan, that it is highly likely that it is subject to ERISA. And of course, there are some gray areas there, and it's good to seek advice of counsel if you have uncertainty on some of those areas. And of course, some plans are not subject to ERISA. Your POP plan is actually not an ERISA plan, although the plans under it might be subject to ERISA and generally are. Also, dependent care plans and voluntary benefits may not be subject to ERISA. We're going to talk briefly about voluntary benefits. These would be the types of benefits that might be purchased by an employee through a provider like AFLAC. And these types of benefits are called voluntary worksite benefits, and as long as you meet these three conditions, you do not have to treat these as ERISA benefits. And a fourth condition that is rare but is worth mentioning would be that the employer doesn't receive any monetary compensation as a result of employees enrolling. But the three conditions we're concerned with primarily are no employer contribution, you don't run the employee's contribution through your POP plan, and the employer does not endorse the plans either in writing or even verbally. So to treat these plans as non-ERISA, you want to take a very hands-off approach, and you want to direct questions and enrollment and all aspects of the plan back to the representative who you have allowed to come into your space as an employer to promote these benefits. You don't want to get in the way and take part in that. You really just want to refer employees to that individual and avoid any kind of connection if you want these to be non-ERISA benefits. On the other hand, if you do make them ERISA benefits, go ahead and include them in a wrap document and accept the fact there needs to be an SPD and there needs to be fiduciary responsibility on the part of the employer. So some benefits can really go either way when it comes to ERISA.
There are definite advantages of having an ERISA wrap plan in place. The wrap fills in any blanks that you have. Insurance certificates alone are not sufficient to comply with ERISA, so the wrap fills in any of these blanks to make sure that you would be in compliance with ERISA. It provides the specific language that is required, and it achieves compliance with ERISA's plan document and SPD requirements. Also, additional benefits, it establishes a consistent plan year and ERISA plan number for all of your health and welfare benefits. Also allows consolidation of Form 5500 filings, which can be helpful, such as if you have a medical plan, a life insurance plan, dental plan. Instead of filing 3 different 5500 filings, they're all wrapped together. It would just be one 5500 filing. Also enables the employer to add required ACA-related provisions to health plans, which many carriers are not including in their documents now. And it guides plan administration and provides important legal protections to the employer and the plan administrator.
All right, so the wrap plan is really a great supplement to your existing documents, which you may have from your insurance carrier, both in terms of meeting the ERISA requirements and providing other benefits to an employer. One of those specific areas that Sarah mentioned is eligibility requirements. With ACA and all of the complicated eligibility requirements that go along with it, there has come a situation where many insurance carriers are no longer providing detailed eligibility in their documents. And that's one reason why an employer should be careful to have a wrap plan in place and to detail eligibility for the benefits within the wrap plan. Again, it supplements what is provided by the insurance carrier, and it provides you a place where you can customize some language and details around the plan. And whenever you start to talk about wrap plans and to set up one of these plans, there are some specific areas of attention that immediately come up. And the main point of this slide is that you want to have someone with expertise and training prepare a wrap plan for you. This is not a do-it-yourself type of project. It's very easy to fall into some very deep pitfalls in relation to ERISA when it comes to establishing these plans. It's more than just having a boilerplate document to cover things for you. It's really critical, especially if you are a larger employer, to have this done by professionals. And one reason is the wrap document has a direct impact on your Form 5500 filings. The wrap and the Form 5500 have to agree. The plan number, the dating scheme, and many other factors, which benefits are included, quite a long list of factors are tied directly between a wrap plan as a document and your Form 5500 filings. That also plays into the question of dating the document. And you can't backdate a wrap document. You shouldn't backdate any benefit plan document. However, you can establish an original effective date prior to your effective date that says this plan has been in existence for some time. And so a professional can help you to make that determination of how to date the document to maximally protect yourself and hopefully remedy any non-compliance that has been in the past to the greatest extent possible. Also, describing benefits included in the plan, we find it's customary in the industry to sometimes include a lot of information that may not be required. For example, the names of insurance carriers and the policy numbers, deductible amounts, and things that may change from year to year. The net result of that approach of duplicating that information in the wrap when it's already provided in other documents, the net effect is to cause the employer to have to continually update and amend the document. So our approach, although we are capable of doing that approach, Our approach typically, and what we recommend to most employers, is to be more general and refer simply to the medical plan, the dental, and whichever plans would be subject to the wrap. And then, of course, we discuss voluntary worksite benefits and making a determination there, and that's something we can help with. And the big question, kind of the elephant in the room that comes up in many cases, is the issue of affiliated employers or controlled groups, which can become quite complicated. I'm sure our CPAs in the audience are very well familiar with all the complications that come into controlled group determinations, and you want to pay very close attention to that when you establish a wrap plan so that you're not inadvertently heaping up compliance requirements that the employer might be able to avoid otherwise. So it's a matter of being very, very careful and having, again, some professional expertise applied to the development of the wrap.
And under ERISA, there are two streams of documentation that are required: what is administered and what is actually communicated to employees. You have the plan document that's administered, and then what is communicated to employees is the summary plan description, or SPD. When either of these documents, or when these documents need to be amended, you have an amendment, and the summary of material modifications is what is given to employees. The plan document has a lot of legal language, which may not be an issue deciphering for a lot of those listening on this call, but we have informal language that is actually communicated through the SPD to employees. And the plan document governs plan operations. The SPD explains the plan benefits and participant rights. Here we have an image showing what the standalone wrap SPD all encompasses. You have your booklet certificates, your certificates of coverage, any other SPDs from benefit, or just any other descriptive materials. And the standalone wrap SPD encompasses all of these, fills in any necessary gaps, so that you have a complete ERISA compliant SPD.
Right, and again, that's the goal of today's presentation, is to make sure that you can have complete documentation so that if that auditor knocks on the door, like they're doing with so many groups at this time, they will not find gaps and contradictions and problems within your documentation. That's really the goal of establishing a wrap and also updating cafeteria or POP plans. It's often asked, okay, we go ahead and establish documentation today to fix our problems, cover up gaps, deal with issues, and we're compliant today. What about the long-term strategy? And so we've developed a simple 7-step strategy, and we want to provide this to you just as general reference to help you as an employer to keep ERISA compliance in focus and not to lose sight of this or allow it to get out of control and leave you exposed to those potential penalties. So the first thing you want to do is identify which of your benefit plans are ERISA welfare plans. Next, all those plans should be reviewed by a qualified person to see that they are compliant with ERISA and other requirements. And then you want to adopt an ERISA compliant wrap document to fill in those gaps and cover any holes in compliance that might be in the existing documents. Distribute the full summary plan description to employees on time. And then if the document needs to be amended, there can be many reasons for that, but as that need may arise, you want to go ahead and formally amend the document, treat it as a legal document, a legal instrument that the employer is using to describe and maintain and govern their benefits. And then, of course, with the plan amendment, there's a summary of material modifications that goes out along with the SPD. And every 4 to 5 years, it's a good idea to fully restate, replace old documents. I can't tell you how many employers we have spoken with that when we say, how's your cafeteria plan? They say either what cafeteria plan, or they might answer something like, Betty Sue set one of those up for us about 14 years ago. I'm sure it's in the back of a drawer somewhere, and we'll go look for it. You don't want to allow your documents to gather dust like that. And ERISA requirements do have a general 5-year distribution cycle. And so the SPD is, in most cases, distributed within 5 years. And so restating the document gets you a nice fresh copy of your SPD, and you can stay ahead of that cycle and those ERISA distribution requirements. And of course, if you're a larger employer or for some other reason have the Form 5500 requirement, you want to stay on top of that.
So at this time, this concludes our webinar. We just want to thank you guys for joining. And again, we'll make these slides and the presentation available shortly on your association site. So thanks so much.